The month of November is Men's Health Awareness Month, and it focuses on three things. It focuses on prostate cancer, testicular cancer, and suicide awareness in men. But there are lots of other health issues that are more prominent in men than in women. Things like cardiac health, ischemic heart disease, things like diabetes. So all these things, I think, are things that we'll be trying to put across on Thursday.
It's so important that we learn as a society to support each other, and often we forget that families look different for everybody. Men have very heavy life loads, and just as women do, but they aren't always talked about the same way. They aren't always accepted. It's always maybe more of an expectation. And I think that that's why men's health is so important. Often men are only starting to look at their health when they're forced to. And we really need to think about it before that, so that you don't get to a position where you're needing to make lifestyle changes because you have no choice. We want to, look at prevention.
Because traditionally the sort of stereotype of the man is to be strong and to get on with it, and not necessarily to stop and talk about vulnerabilities. But that's changing, isn't it, bit by bit?
Absolutely. That's exactly what I was just thinking as you were saying that. Thankfully, that view is changing. And it's important. We need to be open. We need to be aware of our weaknesses, and we need to think proactively about our health. There are lots of mental health issues that affect men, and men are probably not as open to talk about them. So I think that's what we need to address. Think about our lifestyles in a holistic way: physical health, mental health, and also our social health.